สวัสดีค่ะ So welcome back to Tea Talk Live webinar. So we said today we're going to meet the expert. Why we say so? Because we are now going to meet Professor Dr. Hiranyakas. So he is the Professor Director, Bangkok Phuket Colorectal Disease Institute, Director of Colorectal Surgery Clinic, Bangkok Hospital Headquarters, Secretary General, American College of Surgeons, Thailand Chapter, and Governor in the National College of Surgeons, Chicago, USA. So we're gonna meet the expert, Dr. Art.
Thank you. Thank you for your kind introductions and thanks for having me.
Yes, we discuss about so many topics every week, but I'm expecting this week as well. The topic is so interesting and it's concerned our everyday life. And of course, if we have this kind of problem, we cannot live well.
Exactly. I would agree with you because these colon cancer issues is trending and the number of the new patients are increasing each year.
Yes, I think everybody may try not to talk about this topic, but you know what? This is the most important part of our body, and we cannot live well without taking good care of our health, and it's related to everyday life and also behavior about eating behavior, right?
Yeah.
And besides that.
Yeah, today we are trying to gather all the misunderstanding or questions that I have been asked over a period of time to clarify. Hopefully it would be very useful for those who are RFC and who are right now logging on for this webinar with us.
Yes, we heard about so many topics, many stories, but I wonder whether it's the myth or it is the fact. I found out since I born and lived for over 50 years on earth, and so many things we believe it was the fact, but actually it's not.
Exactly.
I have the question, so let me ask you, since you're here with us, for example, so I go quick to the point.
Okay.
Let me ask you, many people facing this problem, or they think they have hemorrhoid. Can hemorrhoid turns to cancer, doctor?
Yeah. First of all, I would like to overview a little bit about the information regarding to colon cancer. If we looked at the whole world, we would see that cancer is one of the most causes for death for the world population. And if you look more specific to colon cancer, we could see that colon cancer is the second leading of death for all cancer patients. And of course, the incidence of colon cancer worldwide is only the third to lung cancer and breast cancer. That's why colon cancer is the hot topic, and that's why colon cancer is so important, because as you could see from the slide, that one out of 20 population that we see walking through us each day would one day get colon cancer.
Oh yeah. Most of the people focus only on, especially female, focus on the upper part. And also so many people who are smoking, heavy smoker, they focus on lung cancer.
Exactly.
You talk about 20%.
Yeah.
And maybe we will ask them to focus more, especially on these parts of the body.
Right.
Yeah.
And the best thing for this killer is that it could be prevented.
That sounds good.
Yeah. And back to the question that you just asked me just now, is that does hemorrhoid is related to colon cancer? And the answer is definitely no. But the one thing which is very important regarding to the hemorrhoids is not the hemorrhoid itself, but the symptoms that would bring patients or would make patients think that they have hemorrhoid, but really they're not.
Oh, okay. So that sounds scary if they accept that they have hemorrhoid, but actually it's not.
Right.
Wow.
Yeah, because most of the time, once they would notice bleeding from the anus, they would think right away that they might have hemorrhoids without going to check with the doctor, without going to check with the specialist. They would right away go to the chemist or the pharmacies to get the over-counter medications, either oral medications, suppository, or creams, or something else.
Or doing nothing and saying, oh, it's not. Maybe a couple of days will be better.
Right. Yeah.
Because so many people feel shy to talk about this part and ignore it.
Right.
Okay, so it is not. So hemorrhoid will not turn to cancer? No. Okay. So if you have something happen like that, do not say right away that it's hemorrhoid, because it may not, and it may cost you.
Yeah.
I heard that word, killers. Oh, that sounds scary.
Right. Having blood in stools is very important. So once you could notice blood, no matter it's fresh or an old blood, it would be significant and very important. No matter how old are you, no matter you're 20 years old or you're 50 years old, if you have blood in stools, that's the red flag for you to come to the hospital right away. That's
not the story of the old age. So that means cancer will also happen among the young population?
Yeah, that's correct. Because from the observation worldwide, we saw and we collected all the data, and we saw that the population of cancer patients, especially colon cancer patients, has been younger and younger in the recent year. And that's why the recommendation, we used to recommend everybody at the age of 50 to come for the colonoscopy or any kind of colon cancer screening. But nowadays, since we know that the population of colon cancer patients, especially the new cases, got younger and younger, so that's why the recommendation for screening for colon cancer recommended by the American Society of the American Society of Cancer would recommend anybody at the age of 45 rather than 50. Now we
45.
Shift to 45 to come to the hospital, and without those, we're talking about those without symptoms.
Without blood in stool, without any sign.
Right.
Okay, but 45.
45, you should seek for colon cancer screening to prevent colon cancer.
Okay, is there any difference between American people and Thai people?
Actually,
by daily behavior or kind of meal?
Right, that's a very good question. Because in the old day, we believe that the incidence would be high only in the northern American countries, European countries, Australia, New Zealand, or even Japan or Korea. But nowadays, the globalization would make us everywhere in the world would be using or having a similar behavior, especially lifestyle and diet behavior.
Yes.
Especially in Thailand, in Phuket in particular.
Yes.
It's like quite frank and obvious that we have developed our eating culture, I would say, from pure Thai food in every single meals, but nowadays we have Western style diet at least like 2-3 times a week or even more.
Yes, because at the beginning I'm thinking of Thai way of eating, but if we still use the old way like grandparents way, maybe something different. But nowadays we can just, I don't say we have to drive to the restaurant, but we just...
Yeah, it's very convenient, right?
Nowadays, very convenient.
Yeah, you just stay home and then pick up your cell phone and then just make an order, and then right away the meal would be at your front door.
Yeah, we need just to call the rider.
Right.
Okay. So yeah, you have mentioned about that. So young generation also facing this kind of problem. So that means if they are 45 years old, they should do the blood test, and later on or right away, they have to do the other test or investigation. So can we start with the blood test?
Right. That's another good question as well, because like nowadays, the recommendation from us is that in order to screen for colon cancer, there are actually two big groups of tests that we can look for. The first one is the stool-related test. We would test stools for occult bleeding. Occult bleeding means the bleeding that no one could see with the bare eyes.
I see.
Occult bleeding is the bleeding that you could only see with the magnified microscopy and with some tests, right? So that's one group. In the old day, we used the WAC test, which the accuracy is around 50%, which is very bad. And nowadays we use FIT tests. FIT test is fecal immunochemical testing. That's the new generation or new platform to check the occult bleeding in the stools, and that bring the accuracy up to 70%, which is quite good. That's one of the options, and the other option, which is way better, is to look at your large intestine, just to do the, in other words, is to do the anatomical test or colonoscopy or CT colonography in order to see the real large intestine of yours. And the benefit for colonoscopy is not only to see if your large intestine is in good shape, but at the same time to take some biopsies or sometimes to do microsurgery during the procedure as well.
So that means we also, if we cannot remember all this, we also can call the hospital and contact to colorectal centers. Yes, but just contact our contact center, and they'll connect you to the nurse at the station, and also can make an appointment to see our doctor as well.
Yes. That's very simple. And the most important thing regarding to colon cancer screening is that blood test is not available and blood test is not recommended. Unlike other organ cancer, that blood test would be recommended, like prostatic cancer, PSA, but colon cancer, I would say, not only I would say, but the standard recommendation from many organizations would refuse or not recommending the blood tests. And the blood test that we used to see people doing is the CEA. CEA is carcinoembryonic antigen. I say now here that CEA is not recommended to use for colon cancer screening.
Okay, so that if you do for example, so many people, they do the annual checkup, and they found out that I already do the stool test, I already give the urine sample to the nurse. That is not enough. If we want to focus on colon cancer, we have to do more.
Actually, stool test is one of the options.
Stool test, beginning.
Yes, stool test is good. So stool test, at least stool test is standard. But if you looked at the accuracy of the stool test, it would be only 70% as compared to colonoscopy, which is close to 100%. So if you do the stool test with a lower accuracies, you might need to do it more often. The standard recommendation is to do the stool test and seek for occult bleeding, to do it 2 times a year.
Okay, not just once a year. Even once a year, someone never do that. I have to say.
Right, but colonoscopy, but if we looked at the colonoscopy, that says
how often we have to do that.
Exactly. If one person would love to go for screening, and he or she would get 45 years of age, and then he or she would come to the hospital and then have the colonoscopy. And once we perform the colonoscopy for that particular person, then we don't see any abnormality, no polyps, no cancer, crystal clear, nothing happening in the large intestine. The recommendation for the next colonoscopy would be 10 years.
Ooh, okay. I'm thinking of 3 or 5 years, so 10 years.
Right.
Okay. So we make it clear and we can stay calm.
Mm-hmm.
Okay, for
Right.
10 years.
Yeah, unless you have symptoms, then you can come earlier.
Okay, okay, I understand that.
Mm.
But I think if we do the check, if we find out something, if we found something, it's early
Mm-hmm.
enough, and then it's better for, I have to say for you, to
Right.
keep the treatment.
Yeah, because
Yeah.
we believe in prevention.
Yes.
Prevention is better than cure. So let's get back to the slides.
Mm-hmm.
Can we have the slides with little mushrooms,
Oh,
please? The pink one, yes. Thank you. So
it's look cute.
right.
In pink.
Yeah, this is the simple diagram for every one of you to understand how colon cancer comes about.
Wow.
So at the very right, you could see that that's cancer already with all kind of symptoms, you name
Mm-hmm.
it, bleeding,
Mhm.
pain, change in bowel habit, constipation, sense of incomplete evacuation, and so on. But the very left side of your hand, you would see a very tiny
Mhm.
knot or
Lump
dots.
or polyp.
Yeah, that's polyps.
Yes.
From the very beginning of the polyp to cancer development, and that would take around 5 to 10 years.
Oh, that's why you need to
So you have a lot of
check.
gap, right?
Ah.
So that's why in the old day, by statistics, we found that colon cancer would be found most among 60 years old patients. So that's why we ended up recommended everybody at the age of 50,
Mhm.
10 years prior to that, to come for screening. And those behind reasons is that we would like to identify the polyps, and then once we could see the polyps with colonoscopy, the gold standard, we can remove completely the polyps, and then that person would be free for cancer for that particular area that we remove the polyps. So as you can see, the polyps is very small as your fingertip, like little fingertip.
Mhm.
Then that would not cause any symptoms.
Mm.
That's why screening, I would emphasize that anybody to come for screening, you don't have to have symptoms, because
So-
what you have would not cause symptoms.
Yeah. So which side will affect to our everyday life? I think the third or the fourth one starts stirring.
Right.
And
Yeah, I think that the two last, one to the right, might cause some symptoms, bleeding or constipation. Yes.
Oh, yeah. Okay. So that means if we have blood in stool, the first thing we should do is not going to the pharmacy.
No.
Okay. That means if we got blood in stool, it's already a signal of something.
Yeah, a red flag of something.
Oh, yes.
And in order to see whether or not the blood would come from hemorrhoids, or the blood would come from polyps, or even colon cancer, it would be quite simple and very quick to know. Once you see the specialist would do the anal exam, and sometimes the doctor would be introducing what we call proctoscope to see if your hemorrhoids got problem, or most of the time, if the doctor would put the finger to do with the examination to your anus, most of the time we could feel something that can tell us.
Is this painful, doctor?
Not really, especially here in Bangkok Hospital in Phuket, or even Bangkok Hospital in Bangkok. We use the gel that contains anesthetic, so that you will not feel anything. Just a little bit of discomfort.
Okay.
And that's all.
Okay.
Right.
Discomfort.
Mm-hmm.
But to be healthy and to live with something healthy in our body, that organs will be used and must be used the whole life.
Right.
I think I will take care of this part as well. Yeah.
Right.
So we have to focus on it. And if it is hemorrhoid, a doctor will confirm for us, and we can stay calm and give the treatment for the hemorrhoid, and we will not think about cancer for at least like 5 years,
right,
or 10 years.
Yeah, because I think it's very, very difficult for ordinary people to tell, even though they could feel something at the anus, it would be difficult for them to judge whether or not that would be hemorrhoids or it's something else.
Oh, how can we check?
Yeah, right. Let's the next photo is quite scary. If somebody is so scared of something easily, you just close your eyes, okay? Right. Yeah, right. This one.
Okay.
This is the photo of a gentleman, 60 years old gentleman, came to the hospital, came to me with the symptoms of
I think
hemorrhoids.
it's not hemorrhoid.
He said hemorrhoids.
He said hemorrhoid.
He said hemorrhoid at
It
first.
doesn't look like.
Right. He said he could feel his hemorrhoids, and his hemorrhoids bled. That's why. And he went to the pharmacies and he took some over-the-counter medication, suppository, and didn't get better.
Oh, yeah.
And the lump still there every time he went to the toilet and move his bowel. So that's what we saw in the clinic. But this one is the picture in the operating room, though. In the clinic, we don't put those fancy instruments on you. Don't worry about that. So as you can see, that's the polyps that we talking about. The polyp
that's the one from the right side,
yeah,
that you just show us, the pink one.
Right, closer to the right side. So as you can see, the stalk of the polyp look just similar to the mushroom. You can see the stalk downward, and then you could see a very nice mushroom above it. That's the polyp, and this polyp is about 3.5 centimeters in diameter, and we managed to remove the whole thing just in time, and hopefully we're still waiting for the pathology results. Hopefully the guy would not get to have cancer.
And let me ask you again, how old is he?
65.
65.
Right.
And it was the first time that he come to see the doctor, right?
Yeah, it was the first time.
If he come earlier, maybe it will be even better news.
Yeah, that's a good point, because if he would come to the hospital
at the age of 50, 55.
Right. Yeah, if he pay attention on the recommendation of how to get away from colon cancer, and he know from his heart that colon cancer is preventable, and the screening, the best timing to get the colon screened for cancer is 50 years old. So if he came at that time, yes, I think it would be much easier.
His mushroom maybe doesn't have chance to grow.
Just a very tiny
mushroom.
And very easy to take it away.
Yes, and don't stuck in the mist. Let's come and find out, better know the fact and deal with it. I think that is much better. So if I do not have relative in my family, because we talk about cancer, we think about family story and genetics, something like that. If I don't have anyone in my family who has like bowel cancer, I think I don't have any chance to have the cancer, right?
Right. The fact is that around 85% of the patients with colon cancer would be what we call sporadic cases. That sporadic cases means you don't need to have any family members with colon cancer.
Oh, I can be the first one.
You could be the first one, yes. Okay. Only 15% of the population with colon cancer would be involved in the group of familial colon cancer kind of thing.
Oh, yeah.
So very few. So, but if you have some members, but not significant, not as to complete the criteria for familial colon cancer group, so let's say if you have one or a couple family member, or even first degree relative with colon cancer, your risk would be increased 2 to 3 times as compared to the other general populations.
So everyone have the risk? Yeah. But for those who has family member or relative, not family member, relative who has this bowel cancer, for example, they have more risk.
Right. There's some questions from the audience, I guess. The first one is alcohol related to colon cancer? Alcohol would link to all kind of organ cancer, including colon cancers as well.
Oh.
Yeah, but alcohol is something that we have to talk in details. Like social drinking sometimes would be beneficial to your heart, but heavy drinker would not be a healthy way to practice.
We need episode 2 for that topic.
Right,
I think.
right.
Yes. And also ask, can you kindly talk about cancer risk for rectal ulcer, pelvic floor, and also
manual ejaculation. Right. Right. Rectal ulcer. If we talk about rectal ulcer could be caused really by constipation. In a group of patients who have very severe constipation, and sometimes it's very difficult for them to empty their bowel. Sometimes they would need to use something to assist the defecation or in order to move their bowel completely. And most of the time, that instrument that they would use is the finger, and they use the finger to evacuate to make sure that all the feces, all the stools is removed completely, and that's quite difficult for them to move their bowel each day. It would take over 30 minutes in order to finish those maneuver. But by using the finger with the fingernail, the fingernail may scratch the rectum or the rectal wall, and chronic scratching may cause what we call rectal ulcer. And
also ulcer with bacteria.
Yeah.
It's
right. Exactly.
Kind of.
So actually, rectal ulcer. If we talk about rectal ulcer, if we diagnose somebody with rectal ulcer, we would need to do the very careful history taking, physical examination, colonoscopy, tissue biopsies, make sure that there's no cancer cells before giving the right diagnosis of rectal ulcer. And rectal ulcers is a different thing that most of the time would not need surgery. We do biofeedback or pelvic floor retraining for those who have rectal ulcer, and the majority of rectal ulcer would be gone after the constipation and the abnormality of the pelvic floor anal sphincters is solved by the biofeedback therapy. Yeah.
So bleeding can be hemorrhoid, can be rectal ulcer, can be cancer.
Yes, but manual ejaculation, I don't think is related.
Okay, so the people with constipation carry the higher risk, as you just mentioned, right?
Yeah, yeah. And then the other issue, the other question from the floor, no, not from the floor, from the audience. This is very interesting question as well. They asking about what's the best food to prevent colon cancer. If I'm not sure if you live in Thailand, if you live in Phuket, I'm not sure, because I believe our audience might be from other countries as well. So to prevent colon cancer, I think if you're already in Thailand, let's say, or Phuket, the best food is Thai food. Why so? Thai food has got we have brown, especially if you like brown rice.
Without coconut milk, is there anything and spicy?
Spice is good as well. Let's talk about rice first. Rice is the main dish, main portion, main ingredient of Thai food. Let's say if you choose brown rice has got lots of around 7%, or sometimes if you cook in a certain way, you can get up to 50% of resistant starch. Resistant starch is the starch that is not going to be digested in your stomach, in your small intestine, but it will go right away to your large intestine, where the healthy bacteria would be ferment the resistant starch or fiber and change it into the chemical called short chain fatty acid, especially butyrate. And that short chain fatty acid has been proven from many of the medical literatures that could affect polyps. It could make polyps go away.
Mm.
Even early cancer could be gone by exposing to these short chain fatty acids as well.
Okay.
That's one thing. And the other thing, the other good things for Thai foods is that Thai food contains lots of fresh herbs, which is not only good for your large intestine, but would be beneficial for your whole other organs as well.
All way of Thai cuisine or Thai cooking.
Yes, and spices is good for cancer. If we extract the chemical from chili, we would get capsaicin, and capsaicin is actually one of the ingredients for chemotherapy to kill some cancer.
Can we get that extract from other things?
Oh, no, it's contained in Thai food already, so that's why we're so lucky to have this kind of food in every meal, right?
And that means I make it easy for me, for myself, or I may talk to someone I love at home and I will not use long sentences or not be able to use long sentences as doctor. But that means if we eat brown rice, I keep that with brown rice, it's good and it's better to eat normal one, right?
Yes. But if you don't like the taste of the brown rice, you can mix with the white rice with some portions like 50-50 or whatever you like. And the other question from the audience, this one is very interesting again as well. Is the healthy gut related to the healthy mind? What do you think?
Yes, it is. It is.
Yeah, I think so.
If I can release and clear myself before coming to work, that is a happy day.
Right.
Yes.
If you put in a scientific perspective, lots of literature has been proven that stress is related to cancer development, not only colon cancer, all kind of cancer.
Yes.
And the reason for that is that we do know that brain gut axis, there's actually a connection between brain and gut as a whole. So brain can in a certain condition for brain, if brain without stress would secrete some other type of hormones that would keep the guts healthy.
Yes.
Right. So and your bowel movements, once you're in a good mood, your bowel movement would be more regular as well. So yeah, there's so many reasons scientifically to explain the connection between healthy mind and the healthy guts.
So many people treat themselves by giving and feed themselves with a happy meal, and they think that's the way. That's the way to keep them happy.
Yeah. And the other question, do we have to concern much how we wash the chemicals from vegetables and fruits? That's very important because some of my patients who came to see me with colon cancer, especially in youngsters, they told me that they love, they eat healthy, they always have vegetable as their main portion, but why eventually they would get colon cancer? And the answer is the chemical hiding in your vegetable and fruits, especially in this part or area of the world. We still have lots of percentage of insecticide in our vegetables and fruits. But the trick, that's not the end of the day, and that's not the end of the world. So the trick for this is that try to choose the local fruits or the seasonal fruits or vegetables. Let's say the fruits or vegetables that would be picked up easily and grown easily in and that
not
season.
Last long and import from far away, because they have to try to keep them fresh.
Right. So if you choose the local fruits and vegetables and the seasonal fruit and vegetables, there would be no reasons for the farmer or even the sellers to increase their cost putting insecticide,
Yeah,
right?
I heard that it's cost a lot
Right.
of money.
So that's one of the way to get around this issue. So don't eat too fancy.
Yes, and there are many people now that grow everything's around their
Right.
house, their garden. So we have kind of edible fence,
Right.
edible garage
Yeah,
that we can
that would
pick up
be
our own vegetable.
Greenland. Yeah, that would be
And the
Greenland.
thing is, tastes even better.
Yeah, and it would be best if they could sell them to the others to make others healthy as well.
I used to have something grown at home, and I have to invite my neighbor to pick them up because it's too many.
See, Thailand is the world kitchen, so we can grow things easily.
Yes. So
Let's
okay.
see this. When can I do biofeedback therapy? After how many days of doing colonoscopy and removal of polyps? If you're really a constipated person, and make sure, and my recommendation is to make sure that your colon is not blocked by the lump or polyps or the tumor. So colonoscopy would be recommended prior to doing anything. And then after that, if you can prove that there's no blockage, then the next step is to do what we call the test. That's called anal manometry in the anorectal EMG, in order to see the function of the sphincters. And with the particular condition of the patient, these manometry and EMG could tell of whether or not you have issues on sphincter functions that would cause the constipation. Then if we can prove that, we would recommend the patients to start the biofeedback. And usually we would offer around 5 sessions of biofeedback in order to retrain the anal sphincters to be back to normal again, and to cure the constipations and not to use the fingers to assist with the evacuation anymore. Then after stopping the evacuation using the fingers, then the ulcer that we mentioned earlier would be eventually smaller and smaller and gone.
Very basic. You talk about finger and assist constipation. Is there any other possible way then? If we don't use finger, is anything can help?
Because this group of patients has been trying many
different
methods.
possible ways.
All kind of ways. Sometimes they use water irrigation, and that's not strong enough. And sometimes if they're lady, sometimes they would go in, put the finger into the vagina to push to the back of the vagina, make sure that the stool would come out. So they would try many ways or procedures already, and these definitely should be taken care of and looked after.
I think after seeing doctor, do the investigation, doctor will give the plan of treatment, and we will see. I think not everyone will be the same.
No.
So
no.
Let put the job on our expert.
Right. And can we have the last slide, please? Excuse me. No, not that. This one. Yeah. The last slide. So you could see this is the tumor or cancer located. This is the large intestine, but the last bit of the large intestine. Yes. You can see that's the anus. Yeah. And those pinkish things in the diagram at the end is the sphincter muscles. And any cancer located in these locations is called rectal cancer. Rectal cancer, the importance of the rectal cancers is that most of the time, if the patient would see general surgeon, not colorectal surgeon, not the real
general surgeon.
Yeah, okay. not the real specialist. Sometimes they might recommend to remove cancer together with the whole anal sphincter complex.
And after that, they have kind of the back hanging in.
Exactly. At the end of the day, at the end of the treatment, surgery, the patient would be ended up with the permanent bag or colostomy.
Okay.
But yeah, but there are lots of studies and literatures reported around the world stating that rectal cancer should be taken care by the specialist.
Yes.
The reason behind that is that there would be a very low percentage of the permanent colostomy if the rectal cancer patient would see the colorectal surgeons, because colorectal surgeons at the end of the day can take the whole tumor out, clear out all the tumor, and at the same time to preserve your sphincters as well.
Yes.
Yeah, to keep the sphincters. The treatment of rectal cancer in colorectal surgeon's hand would be would have more percentage of the anal sphincter preservation.
So if you're somewhere, not here, if you got or you met the surgeon already and you got kind of the plan of treatment, don't do it yet until you see the colorectal surgeons, until you see the expert who really can take better care and best care of that corner.
Right.
So I think every part of the body we have specialist or the expert who can do his job, and don't let it go. Just go to see the expert or specialist to get. I think it's always an opportunity.
Yeah. We call it the second opinion. And nowadays, we should have the second opinion for everything in life. So once we get some information, we have to validate that information and see other opinions if there would be a better option, right?
Yes.
Yeah. So but beside sphincter preserving procedure for rectal cancer, nowadays the technology for surgery has been leading to painless or less pain surgery, or keyhole surgery or minimally invasive surgery, and that would be applied for also colon and rectal cancer patients. And we do it a lot in Bangkok Hospital, in Phuket, and even the headquarters.
So let's say that means we are not, everyone will not end up, not everyone will be end up with the bag. So at the beginning, when I get a topic, I feel like everything I heard, I know before was, now I can identify is the myth, but now I get all the facts from the doctor. And I feel like this topic is kind of scary topic for me, but now I feel like I want to have my test done, I want to take care of my body, and I want to have a better and healthier life.
Yeah.
So
is it the last question here? Asking, would all polyps become cancerous eventually? Not really.
Yeah.
Yes and no. Yes and no. There are many types of polyps, at least like 5 categories of polyps. But the most important polyps that we would look at is the polyp called adenoma. If you can go back to the mushroom diagram,
the
please.
pink one.
The pink one. Yeah, okay. You can see that the polyp that would have the largest chance to develop for cancer is adenomatous polyps. You see the second one to your left on the top, right? Adenomatous polyps. That's the type of polyps that we would look for and be cautious about, because this group of polyps would have a higher possibility to become cancer, and that higher possibility would be carried around 35 to 40%. So that might answer the last question from the audience.
Okay, so short after this, if you still feel like you want to know more, you want to ask some more questions, you also can stay with us by sending us an email or text a message to us. I think since you are here with us, you know how to reach us. And to reach Dr. As, just contact 1719 and make a reservation. And let's say the happy cats will be there. If you see the expert. So get the right answer, don't start with a miss. Okay, thank you so much for
Thank you.
Good to have you here today, and stay tuned next week. what can I'll let you know. Thank you so much and have a good day. Be healthy.
Thank you.
Bye bye. ขอบคุณค่ะ